So like I said, this is the 240 Allegheny nursing review for dosage calculations. If you have questions, please just type it into the chat or you can unmute and ask. But like I said, I have 3 questions that were emailed to me that I want to start off with from the packet. The first one is the number 29, and this is just a marking of the syringe. And this syringe is a little bit tricky, okay? So because it doesn't clearly indicate any of the units on here, but it says the order reads flu vaccine 0.5 ml, mark the dose on the 1 ml tuberculin syringe. So when I look at this syringe, and because it tells me it's a 1 ml tuberculin syringe, the clue that lets me know what units or what numbers to use is the total for the syringe is 1. And you can see when we look at the syringe here that the total at the bottom set of numbers is 1. So when I mark this syringe, I'm just going to mark right here at the half mark, okay? That 0.5 is what they're asking you to do. So you're ignoring the 4, 8, 12, 16, whatever those M numbers or those M indicators are, those aren't milliliters. We're assuming that the 0.1 up to 1.0 is milliliters because 1 milliliter is the total for the syringe. All right. 33. If I can get to it. Oh wait, maybe I have a different set. This is the diltiazem. Let's see if I can find it. Maybe I don't have this.
Yeah, that was the new one we got it, and these they add 3, 4 question in the last.
Okay. Well, you gave me enough information here, so let me get it answer. Let me add it here, and then that way we have it. So give me just 1 second. Okay. Sorry about that delay. So I don't have this newer packet, but I'll just go through these questions here. Just add them down here. All right. So this first question says, a nurse is preparing to administer this medication. I'm not even going to try and say it. 0.25 milligrams per kilogram IV to a client who weighs 176 pounds, and then the available is 5 milligrams per milliliter. How many milliliters should the nurse administer? So this is a weight-based question where you got to take the patient's weight in pounds, convert it to kilograms, and then multiply by the order, the 0.25 milligrams per kilogram. That'll give you your milligrams, and then you can solve your milliliters from there. But let's look at it and see, just in case there's any trickery in this. All right, so I'm going to take the 176-pound patient, divide by 2.2, and I get 80 kilograms. I'm going to take the 80 kilograms and I'm going to multiply by the 0.25 milligrams per kilogram. So 80 times 0.25, and I get 20 milligrams. Then you can do ordered over available if you want, or I'm just going to continue working with dimensional analysis. I want to convert milligrams to milliliters. So 5 milligrams, 1 milliliter. So I'm going to get an answer of 4 milliliters. So you've seen questions like this, or you probably saw at least 1 or 2 questions like this last semester, particularly the heparin protocol. where you did more like converting pounds to kilograms and then multiplying by, instead of milligrams per kilogram, it was units per kilogram. So it's the same process. And the only reason I'm mentioning that is just to kind of keep in mind that some of the stuff is similar. So if you ever get stuck, just try to remember or recall what you worked through last semester with similar problems. All right, and then this last one looks like a nice flow rate question. So what's nice about this is it gives you a lot of extra information sometimes, and it's like, okay, what do I do with all this extra information? So you have a nurse is preparing to administer 0.9% sodium chloride, when then they just in parentheses put the same information. They give you a volume and they give you a time, and they want to know how many milliliters per hour. So all you're going to do is you're going to take the volume over the time, and then they don't want to know minutes, they want to know hours. So you want to convert minutes to hours. And you get 600 milliliters per hour. Now, some of you, like if you just do like 300 divided by 0.5, because you know that 0.5 hours is, the same thing as 30 minutes. Perfect. You're doing that right. Okay. Um, all right. So those are the three questions that were asked. Are there any follow-up questions on those?
Can you check question 11, please? It's kind of, I can't get right answer for some reason. I think it's some mistake maybe on.
Yeah, is it this dopamine question?
Yeah, it's kind of easy, but I can't get right answer for some reason. It's the answer is 22 milliliters. And yeah, can you just check it?
You got it. Yeah, so I do, if I recall correctly, the key here for this one is wrong. Let me just double check. I can't remember if I kept the key on my version of this. I don't think I did. No, because I knew some of the keys or some of the questions were wrong. I also gave you an extra question to practice, so just so you can kind of see this. And this is also along the lines of one of the questions that you had asked me about Pearl was the um, um, where you have to account for the patient's weight in kilograms.
Mhm.
And so this is a good practice. The good thing is you don't have to worry about converting pounds to kilograms for this. So, okay. So for number 11, and I do think that the key is wrong. Um, if I did you get 13.1?
Oh, just a second. No, I couldn't get right.
Okay. Well, I might just be remembering another question, so let me just work through it and then we'll see what it is together. Okay, so the trick with this question is that we have to account for the patient's weight, and we also need to deal with the fact that you have micrograms in your and minutes, and you need to get everything to milligrams, then eventually milliliters per hour. So we have to do some converting here. So the first thing I'm going to do is I'm going to account for the patient's weight, and I'm going to take the 70 kilograms and I'm going to multiply by the 5 micrograms and then the kilogram per minute. So step one is I'm just trying to eliminate units, okay? So 70 times 5, I think that's 350. Yeah. So now I have 350 micrograms per minute. Now, one of the things that, and this is just my preference, because I know I'm working towards milliliters per hour, and if you didn't know that already, anytime they ask you to solve for an infusion and they don't give you a drop factor or anything like that, they want to know milliliters per hour. Okay, so that's what you're working towards. So even though it doesn't explicitly say what you're looking for, you're supposed to at this point know that you're looking for ml per hour because that's the universal standard for your measurement of infusion rates. Okay, so milliliters per hour. All right, so we have 350 micrograms per minute. The first thing, because I know I'm working towards hours, and in my mind, I want to get this 350 micrograms. I want to get that number bigger because I want to convert it to milligrams. And the reason we're doing that is because when you have one thing in milligrams and one thing in micrograms, that doesn't work out. They have to be in the same units. So we have to get them into the same units. So what I'm going to do is I'm going to multiply by 60. So 60 minutes per hour. And then what I'm going to get is that 350 to now times 60. Now I get this big number, 21,000 micrograms per hour. And then what I'm going to do is I'm going to convert. You don't have to show this. If you can do this like just by moving the decimal, that's fine. But I just want to show you what I was doing. I'm converting micrograms to milligrams. So 1,000 micrograms per milligram, which gives me 21 milligrams per hour. Now, as awkward as this is looking, this is just all you're doing is you're converting milligrams to hour to milliliters per hour. It's no different than when you would convert units per hour to milliliters per hour, at least in the strategy. So all I'm going to do now is I want to get rid of milligrams and I want to convert it to milliliters. So I'm going to use what they gave me, 400 milligrams, 250 ml, and then um, I'm going to take 21 times 250 and then divide by 400. And I'm going to get an answer of 13.125. Okay, so this was the question I was thinking of. But we wouldn't write that as our final answer. We would round our answer. So I'm just going to round up, or put my answer up here. So 13.125 would be 13.1 milliliters per hour. So I think the key says 13.125, but that would be incorrect because you need to round your answer.
Dr. Ed, like in overkey, the 11th question is answer is 22 milli. That's why we confuse sometime because it's totally different answer.
Well, I will say because it sounds like you have a different packet than I do. So maybe are the numbers the same?
Yeah, numbers are same.
Okay, then yeah, the key's wrong.
Like, is there any way like we can get the right key for that package?
I didn't make it, so I don't know.
Okay.
I don't
That's
know what the issue is or why that was incorrect. So all you can do is just make them aware that there are mistakes in the key, and then hopefully they'll make those corrections next time.
I
Um,
just watched the video to figure out, okay, the key was wrong, so I was follow the video, so I don't have issue with these.
okay. Yeah, if you like this is what the review is perfect for, these reviews. So if like you go through a question and you're answering it and you're getting the same answer over and over again, but the key says it's a different answer, first of all, you're probably right, but I can always help verify and clarify. The other thing that gets a little bit concerning is like, well, what if some of the other answers are wrong and you also got the wrong answer? The chances of that are less likely. It's more likely that the key is wrong, you're getting the right answer. So thanks for asking this. Was that the same issue in the previous questions you had asked me about?
Yes.
Okay. Were you getting the same answers that I gave?
Yeah.
Okay, yeah. So I have a feeling that there was maybe when whomever put together the packet just translated the keys wrong. So I don't know. Sometimes when I originally made some of the packets that I've made, I wrote the test first, and then I changed all the numbers. But then sometimes I forgot to change the key. And so basically you had the answer for the test question version that was there. Now, I will say that was many years ago, so I would not look into that any further than that. And I can tell you, I did not put together your 240 packet. The only
Okay.
thing I put together was what I put on the shared OneDrive folder. So I don't have what you have. But if one of you wants to email it to me, I can at least update it and maybe make those corrections. But I probably won't be able to do it before Thursday. I would have need to have seen it
And
earlier.
that's okay. I can email you the whole package in case. Like even if you can post after that, that should be fine too, because our exam is in almost 2 weeks.
Yeah. Yep. No, isn't it next week for you guys? Or do you
Oh yeah,
have, yeah,
I'm not sure. Maybe next week.
I think it's next week because I don't think you have any days off next week. It's you have Monday, the following Monday off, but not this coming Monday. So,
Yes,
yeah.
yes.
Yep. It's coming sooner than you think.
Yeah.
All right. Are there any other questions? So you guys has kind of seen everything as far as 240 is concerned, but I'm happy to look through and answer any questions you have through the packet.
Oh, I have one question. 14. They ask how many milliliters of the drug will you give, but
Mhm.
it's not clear per dose or per or daily.
Okay.
With answer you can say it's daily, but I mean when they ask like this, it's difficult to understand.
So it would be daily, and the reason being is because that's the only thing it tells you order-wise. So it doesn't tell you BID or TID or anything like that. It just tells you they're ordered 200 milligrams IV daily, and um and then you want to figure out how much to administer milliliters per day. And then this is just an injection. So now, the thing that's a little bit tricky is it gives you this extra piece of information. It tells you 100 milligram IV,
Yes.
but that's not helpful. That 100 milligrams IV doesn't necessarily help you with calculating milliliters. What you need is this right here, the 30 milligrams per milliliter. So your order is 200 milligrams, and your available is 30 milligrams per milliliter. This 100 milligrams is just it just tells you like the whole bottle contains 100 milligrams of the furosemide, but it doesn't tell you what to do with that 100 milliliters. That's why you have to look at this part of the label, the 30 uh, per ml. So for this one, you probably did the math right. It was just like where like how they came up with the daily answer. The daily was just based off of the fact that daily is listed, and that's the only option you have. So you're just going to take your order, and it's been a while since I've done this, but over available times your quantity. And then this, I don't think this is going to be a solid answer, so we probably have to round, but 200 divided by 30, you're going to get 6.6 repeating. So you're just going to round that to 6.7 milliliters. So I don't know that you need to write daily with that or not because it's stated within the question. Now the other question is this daily doesn't necessarily tell you per dose. So are you supposed to divide this out? That's information that is not listed there, so you can't really assume either way. But my guess is that it would just be a dose, a 6.7 mil dose, and then whenever that's given. All right. Any other questions?
Uh, can we go over 31, the Hepron bolus one?
Yeah,
Absolutely.
yeah, thank you.
All right. So, as a reminder, this question, what's highlighted just helps to kind of um, help you steer your focus towards what's important. The protocol is there's a, it's a whole involved protocol with different things listed, but you don't need to worry about what's happening in all these steps that are crossed out. That's just telling you, like, if you had this set up in the facility, you're following these protocols. What you care about is the math. Okay. And so in the math part, they're going to give you, they're most likely going to give you these two questions. They're going to give you calculate the initial bolus, calculate the initial infusion rate. I don't think that they're going to do this what I have highlighted there in green, but I put that there just for extra practice. Okay. I will also tell you, if you go to the 220, 230 packet, I put a whole bunch of additional heparin protocol practice. So I know I know at least you, Alina, were there last semester and went through some of that stuff. So I would say just go back to that 220, 230 packet, the one that I made for this semester. And just, if you feel like you need it, practice more of the heparin protocol. But yeah, let's go ahead and go through this. So the trick to this is you got to remember to convert the patient's weight in pounds to kilograms. Afterwards, then you just apply it to the protocol. So this is already given to us, the 90 kilograms. I can't remember if I gave that to you or if that was part of um, the packet. Is this the same question in the packet?
Yes.
And is the key correct to your knowledge?
Uh, I'm not sure actually.
Okay. All right. Well,
It
let's.
might be correct because on the key is 90 kg and on screen is 90 kg too.
Okay. All right. Well, we're going to find out together. So, all right. So the first thing here is I'm going to take my patient's weight, 90 kilograms, and I'm going to multiply by my bolus dose, which is 80 units, or my bolus order, which is 80 units per kilogram. So I'm going to take 80 times 90, which I think is 7,200. Yep, 7,200. So 7,200 units. And then I'm going to, I don't want units, I want milliliters. So I need to convert my bolus. So I need to get rid of units and I need to convert to milliliters. And what I'm going to do is I'm going to use my bolus dose strength. And then up here, as a reminder, you have two availables. You have your IV available, 25,000 units, 250 ml. And you have your bolus dose. Since we're calculating bolus, we're going to use the bolus dose information. So 1,000 units, 1 milliliter. And I'm going to get 7.2 milliliters as my initial bolus. For the IV, again, I'm going to use 90 kilograms. It tells me to start off at 18 units per kilogram per hour. So this is pretty standard. So 90 times 18 is 1,620. And that's units per hour. Again, I don't want units, I want milliliters. So I'm trying to convert units to milliliters. But this time I don't want to use the bolus dose strength. I want to use my IV. And my IV says that we have 25,000 units of heparin in 250 ml. And so we're going to get an answer of 16.2 ml per hour. Are those the same answers in the key?
Yes.
Okay, good. All right. So far, you were not led astray as far as that's concerned. All right. So on your test, you're most likely going to see that. Calculate the initial infusion or the initial bolus, calculate the initial infusion rate, and then that's it. Okay. But for extra practice and just in case they ask this, like I said, but I don't think they're going to, it says after 6 hours, there's an APT. They remeasure, excuse me, the APTT, and they find that it's 43 seconds. And then they're looking at the protocol, and it says if that's the APTT, then we're going to rebolus now with 40 units and then increase the rate by 2 units. Okay. So 40 units is exactly half of 80 units. So our answer should be half of 7.2, but we'll double check the math. And then we're increasing the rate by 2, which means if my initial infusion rate was 18, my new infusion rate now is going to be 20. Okay. So I'm going to take my same patient, same weight, 90 kg, times now 40 units per kilogram. And that's going to give me 3,600 units. And then I'm going to convert units to milliliters, again, using my bolus dose strength, which is 1,000 units per milliliter. And so I'm going to get 3.6 milliliters, which is exactly half of 7.2. For the infusion rate, again, patient weight is the same. So we're at 90 kg. But instead of 20 units per kilogram, or I'm sorry, instead of 18 units per kilogram, we're increasing by 2. So I need to multiply by 20 units per kilogram per hour. That's going to give me 1,800 units per hour. And then the same thing, I want to convert units per hour to milliliters per hour. But basically, I just want to convert units to milliliters. We don't use the bolus information. We go back to our IV. So remember that was the 25,000 units, 250 ml. And we're going to get 18 mil per hour. Okay. Again, do those answers correlate with the key?
We don't have these are
Oh, okay, you didn't have the extra 2?
no.
Okay. Like I said, I don't think you need to worry about those. I don't know that in all the semesters that we've had this on the test, I think it's always been calculate the initial infusion rate, calculate the initial bolus, and the only thing that really changes is the patient's weight. So for practice, use your weight, use, your friend's weight, parents' weight, significant other's weight. Just use someone else's weight other than what's listed there. Um, and then make sure you can calculate it based off of that. And if you need to verify your answer, you can just always run it by me and I can tell you if you answered it correctly. I just need to know that you followed the protocol and then I need to know the starting weight. Because that's the only thing that really changes. So all right, any other questions you'd like to look over?
I'm good.
Okay. Yeah. Um, like I said, if you have questions between now and Thursday, you can always email me if you're good to go and you feel like you got this down. And I think most of you should be at that point because this is 240. This is not your first time seeing these things, and you know just to practice it. But if you run across anything in the packet or someone else tells you, "Oh, this was wrong," just email me and let me know. And then I think you said, Pearl, you were going to email me the packet, and that way I have
Yes. Yeah.
the updated packet, and then I'll add those questions and make sure and maybe double check the key
Sure. I will go over everything today for myself. If I have question, I will come by Zoom Thursday too.
Okay. Yeah, I'll be here Thursday again at 2 o'clock, and yeah. And I'm sticking around. So if anyone has any 240 questions, I'm gonna hang out here for the next like 15 minutes or so, and then but I'm gonna pause the recording that way, just in case you don't have